Hello, wonderful students. Myself, Dr. Maddineni, Srinivas, your dermatology faculty from Bharat. So, in this series, that is Derma series, daily engaging revision for medical aspirants, I am going to cover all the chapters of dermatology in the form of very quickly revisable one-liners, high-yielding one-liners related to the chapters of dermatology. So, in this video, we are going to cover the basics of the skin, as you can already see here. So, if you want me to make more such videos, motivate me by subscribing to my YouTube channel. Also do share these videos among your friends, and also first thing you should do is like this video so that it will motivate me to make more such videos on a regular basis. So whatever may be the platform you are following dermatology from, you can utilize these videos for very quickly revising these important chapters. So let us quickly begin the actual discussion of basics of the skin. So you might have already learned that the skin is the largest organ of the body, and it is going to be forming 15% of the total body weight. Yes, you heard it right, 15% of the total body weight, 4 to 5 kilograms, and it will protect our body from various pathogens, microorganisms, viruses, bacteria, and also it will protect from ultraviolet rays and also physical injury, obvious. And skin has three important layers: epidermis, dermis, and hypodermis. Epidermis is the outermost layer, and it is derived from the ectoderm. And remember, it is composed of keratinized stratified squamous epithelium. Whatever are the important points I'm going to highlight in this particular presentation, and anything else if they are important I will tell, and also I will write down. Okay. And next is the dermis, which is the inner layer, and it is derived from mesoderm, and it is going to be made up of dense irregular connective tissue, and it contains collagen and elastin, which is basically going to provide the structural integrity to the skin and also elasticity. And this dermis is very important because it consists of the blood vessels. Remember, epidermis is avascular and dermis is going to supply the nutrients for the epidermis, and it will also consist of the hair follicles, nerves, and other glands. So coming to the discussion about the epidermis, remember we have 5 layers. First one, the outermost layer, which is called as stratum corneum. Remember, it is a dead layer, and it is going to consist of flattened keratinocytes, and it provides a barrier to the water loss, which is called as transepidermal water loss, and also it will prevent entry of the external factors entering into the body. Next layer is the stratum lucidum. Remember, the stratum lucidum, it is present only in the palms and the soles. That is, wherever there is thick skin, we are going to have the stratum lucidum, and it is going to consist of granules which are called as Eyledin granules. Next layer is stratum granulosum. Remember, it is going to consist of granules which are called as keratohyalin granules, which will produce this profilagrin, which is basically the precursor for filaggrin, which is a filament aggregating protein, which is vital for the formation of the protein, which is called as keratin. Next layer which we have is stratum spinosum. Remember, stratum spinosum, it is also known as prickle cell layer due to the presence of the spinous processes, desmosomes. This layer is also called as stratum spinosum, and desmosomes are very important. In the case of the vesiculobullous disorders, we are going to have antibodies against these desmosomes, if you remember, pemphigus group of disorders. Okay. And it provides the mechanical strength and also flexibility. And remember, stratum spinosum has very important cells which are antigen presenting cells, which are Langerhans cells, and they are important in the immune function of the skin. Next layer is the deepermost layer, which is the stratum basal layer, which is also called as stratum germinativum. Why it is called germinativum? Because this layer is going to proliferate and produce rest of the other layers of the skin. That is the reason why it is called as germinativum, and it consists of, remember, two important cells which are melanocytes and Merkel cells, which are, and this layer is responsible for continual renewal. As I've already told you, there is going to be a lot of mitosis happening in the stratum basal layer for the production of the rest of the all the layers of the skin. So remember, stratum malpighian is sometimes used to describe the bottom two layers, which are stratum basal layer and stratum spinosum put together. Okay, spinosum. And remember, thick skin, it is present in the palms and soles because of the additional stratum lucidum layer. And remember, in the very low birth weight infants, the stratum corneum is underdeveloped because it is the outermost layer which is present, and the dermis consists of the superficial papillary layer, which is going to consist of loose connective tissue, and a deeper reticular layer, which is made up of dense irregular connective tissue. Next is hypodermis, which is also called as subcutaneous tissue, which is also called as panniculus. And remember, this is going to consist of the fat cells, which are also called as adipocytes. It is also called as adipose tissue, and it will provide the insulation and the energy storage in the form of the fat. Cells of the skin, remember, keratinocytes form almost 85 to 90% of the cell population of the epidermis and produces keratin, which is essential for the protective barrier function of the skin. And remember, the fungi which are keratinophilic dermatophytes, if you remember, they are going to devour on the keratin. And where is keratin present? It is present not only in the skin, it is also present in the hairs and also in the nails. Next cells are melanocytes. Remember, melanocytes, Merkel cells, Langerhans cells. They are very, very small chunk of the cells which are present in the epidermis. Majority of the cells are the keratinocytes. So melanocytes are derived from the neural crust cells, and they are present in the stratum basal layer. The location and the origin of these cells is very, very important for you to remember. So melanocytes, they produce the melanin pigment, and it is going to protect the body from ultraviolet rays. And the melanocyte to keratinocyte ratio is 1:10. So that is, in the stratum basal layer, if there are 11 cells, 10 cells are going to be keratinocytes and 1 cell is melanocyte. And there is one more number which is very important, which you need to remember, which is called as epidermal melanin unit, if you remember. So one melanocyte is going to produce the melanin pigment and transfers the melanin pigment to the adjacent 36 keratinocytes. So one melanocyte to 36 keratinocytes, this number is called as epidermal melanin unit. So Langerhans cells, antigen presenting cells, so they are going to be important for the immunity of the skin, and they are present in the stratum spinosum. If you remember, we have already discussed this. And there are certain immunohistochemical markers which you need to remember, which are related to Langerhans cells. The most important among them is Langerin, which is also called as CD207. It is a most specific marker. Apart from that, CD1A and S100 also are present, but they are not very important when compared to the Langerin. And it consists of the Birbeck granules, which are going to be seen only on electron microscopy, and these are going to have tennis racket shape. And of course, because they are antigen presenting cells, they are going to present the antigen to the T cells. Next are Merkel cells. If you remember, if you have read in your physiology, you might remember these are the mechanoreceptors which are involved in the light touch sensation, and Merkel cells are also present in the basal layer. Next, we have the fibroblasts. So remember, these are the cells which are present in the dermis, and in fact, they are the most abundant cells which are present in the dermis. They will synthesize collagen and the extracellular matrix, and they are crucial for the wound healing and also the structural integrity. Next cells are the mast cells. If you remember, in urticaria, you might have heard of these mast cells, which are going to produce the histamine. Thus, they are very important for allergic reactions. Next is epidermal stem cells. So remember, in the skin, we are going to have these stem cells which are going to produce all the other cells. Okay. And they are present mainly in the hair follicle bulge area. This point is very important, and they are crucial for continuous renewal and repair of the epidermis. Next, you have to remember certain bodies. So, okay, what are those bodies? Oddland bodies. These are also called as lamellar granules, and they are present in the stratum spinosum and also in the stratum granulosum. Remember, they are very important in which are present in the stratum granulosum, but they can also be seen in the upper layers of the stratum spinosum, and they play important role in the skin barrier function. How do they play important role? Because L for lamellar granules and L for lipid, they are going to produce a lipid which is going to act as an important skin barrier. So now coming to the certain histopathological terms which you have to know. So whenever you heard of acantha, you might be wondering, what is this acantha? So whenever you want to describe something related to the stratum spinosum, you can use the term acantha. So acanthosis is thickening of the stratum spinosum, and it is present. It is seen in the case of the patients of psoriasis if you take a biopsy. Next is acantholysis. I hope you have heard this term, very, very important. And whenever there is any condition where there is a damage of the desmosomes, like for example in the case of pemphigus vulgaris, so there is going to be loss of connection between the keratinocytes one another in the epidermis, and this is called as acantholysis. Okay. Next we have this spongiosis, which is nothing but the intercellular edema. So in between the cells, if there is fluid accumulation in the epidermis, we call it as spongiosis, and this is very characteristically seen in the case of eczema, and precisely it is acute eczema. Next term is dyskeratosis, which is premature keratinization of the keratinocytes, and it is seen in the case of D.E.R.M.A disease, Hailey-Hailey disease. Next is parakeratosis. Remember, this is a retention or persistence of the nucleus in the stratum corneum. Remember, stratum corneum is a dead layer. It should not have any nuclei, but if nuclei are present, we call it as parakeratosis. And it can be seen in very important conditions, psoriasis, papilloscomus disorder. Next is thickening of the stratum corneum is called as hyperkeratosis, and it is due to increased keratin production. Basal cell degeneration, remember this term is used in the case of lichen planus, where there is going to be damage of the stratum basal layer because of the band-like lymphocytic infiltration, which is present in the dermoepidermal junction or basement membrane zone in the patients of lichen planus. Hypergranulosis, remember this is again seen in the case of lichen planus, and this is described as a thickening of the stratum granulosum layer, and in lichen planus it is precisely called as wedge-shaped hypergranulosis. Papillomatosis is proliferation of the epidermis leading to the raised lesions. Not very important because it is postgraduate level. Okay. Next is exocytosis, migration of the inflammatory cells into the epidermis. We call it as exocytosis. So now coming to some important primary skin lesions. So what are those skin lesions? So macule is any flat lesion which is neither raised nor depressed, which is pigmented, okay, hyperpigmented or hypopigmented, which is less than 1 centimeter in size. We call it as a macule. Same description, if it is more than 1 centimeter, we call it as a patch. What is a papule? Remember, solid raised lesion more than 1 centimeter is called as a papule. You might have seen the papules in the case of acne. Plaque is a elevated flat top lesion which is larger than 1 centimeter, usually found by coalescence of many papules, and this can be seen in the case of psoriasis, where you are going to see silvery white scaling present over the erythematous plaques. Nodule is a term which is used again for a lesion which is having raised lesion more than 1 centimeter in size, but it is also going to have a depth component, and typically it is deeper in the dermis. So depth component is very important for nodules, and in the dermatology we can see nodules in erythema nodosum and erythema nodosum leprosum, okay, which you are going to read. So next is vesicular, fluid filled lesion, vesicles and bullae. So fluid filled blister which are less than 1 centimeter. Okay, this number you can remember it as 1 centimeter. Less than 1 centimeter vesicle, and if it is more than 1 centimeter, we are going to call them as bullous lesions. Okay, bullous lesions. And they can be seen in the chicken pox, bullous pemphigoid, pemphigus. So we are going to see that in the vesicular bullous and other viral infections. Next is pus, pinpoint pus. If it is present, we call it as pustule. You can see them in acne. So wheals are high, like I have told you, urticaria, where there is going to be mast cell degranulation producing a histamine. They are going to be wheals are high, which are categorized as the primary skin lesions. Okay, next is secondary skin lesion. So remember, scale is one very important secondary skin lesion, where there is going to be visible exfoliation of the stratum corneum. Okay, is important in the psoriasis, where we are going to see silvery white scales. Next is crust. So dried up exudates which can be seen on the skin surface. Erosion is loss of the epidermis without any scarring. It is erosion. Ulceration is if there is the loss of the epidermis and also dermis associated with scarring. Fissure is linear split or cracks which can be seen in the skin. Scar is the fibrous tissue which is replacing the normal tissue after injury. That is called as a scar. Excoriation are linear erosions which are found by scratching. Okay, scratching. Lichenification is actually a safety mechanism of the skin because of the long-standing scratching. What will happen? The skin is going to become thickened, it is going to become hyperpigmented, and it is going to have increased skin marking. So all these are put together called as lichenification. Atrophy is thinning of the layers, okay, resulting in translucent appearance of the skin. Keloid is the overgrowth of the scar tissue which is going to grow beyond the injury site. Okay, so some miscellaneous points which are also important. So desmosomes are also called as macular adherents, and they connect the keratinocytes, providing the structural integrity. And the desmosomes are going to consist of sub-components which are called as desmogleins and desmocolins. Hemidesmosomes will attach the stratum basal layer to the underlying dermoepidermal junction or basement membrane zone. Filaggrin, if you remember, it is having a precursor molecule which is called as profilaggrin. Remember, this is filament aggregating protein which is going to aggregate the keratin filaments. And mutations in filaggrin can be associated with ichthyosis vulgaris and also atopic dermatitis. Melanin synthesis requires the important rate limiting enzyme which is tyrosinase, and this enzyme is lacking in the case of patients of albinism, because of which their skin, hair and also iris are going to be white in color. Next are the important receptors. So out of this, Merkel cells. Remember, these are the cells which are present. Merkel disc, Merkel cells are present in the stratum basal layer, and they are the slow adapting, low threshold mechanoreceptors. Skin appendages, eccrine sweat glands. Remember, these are very important for thermoregulation via the sweat production. And the eccrine sweat glands, they are going to open directly onto the skin surface. Apocrine glands open into the hair follicles, and they are going to become active during the puberty, and they are present in the axilla, areola and in the genital areas. Sebaceous glands, remember, they are going to produce sebum, and they are going to produce their secretions through holocrine methodology, and they are going to open along with the hair follicles. So in the hair growth phases, remember, anagen phase is the active growth phase, catagen phase is the involutionary translational phase, and telogen is the resting phase. Some other important points. So lamellar ichthyosis, remember, it is due to the transglutaminase 1 deficiency. Ichthyosis vulgaris results from the filaggrin deficiency, leading to absent stratum granulosum layer. And Blaschko's lines, if you remember, they are going to represent the embryonic cell migration patterns, and these are not going to be corresponding to any nerves, any blood vessels or any lymphatics. And the important disease in which lines of Blaschko is going to have the skin lesions is incontinentia pigmenti. So keratinization involves dehydration and the cell death. Granular layer is going to be absent in, like we have already seen, ichthyosis vulgaris and also in psoriasis patients. So epidermal stem cells, remember, they are located in the hair follicle bulge area. Very important point. Fibroblasts are going to produce the collagen. Fibroblasts, they are present in the dermis, and they are the most abundant cells, and collagen 1 and 3 are present in the dermis in the ratio of 8:1. They are present in the skin, in the dermis, in the ratio of 8:1. So collagen type 7, it is mutated in a special type of mechanobullous disorder which is called as epidermolysis bullosa dystrophica. And water barrier function, mainly it is going to be due to the lipids. If you remember, lamellar granules are going to produce the lipids, and it is important for the prevention of the transepidermal water loss, and also to prevent any unwanted entry of the water from the environment into the body. Okay, this was video. I hope it was helpful. Please do hit that like button if it was helpful, and please share this among your friends, and also do discuss whatever we have covered in this particular video so that it will be remembered for more number of days. And if you are having any more suggestions related to this particular series, put the suggestions in the comment section, like for example, to include anything, to remove anything, whatever you want. Okay, this is mainly one-liner series, so we are going to quickly recap all the points of dermatology. Every chapter I'm going to cover, which are very, very important for you to revise very, very quickly. So if you like this video, like I've already told you, please do like it, and also do subscribe if you want more such videos on a regular basis. And as I always say, happy learning, all the very best. If you have any suggestions, please do put them in the comments, like I've already told you. And happy learning. Sarvam Sri Krishna Arpanam Sarve Jana Sukhino Bhavantu. Thank you so much. Thank you so much. All the very best. All the very best. Happy learning. Bye bye.